The Mukhobanana family, a youth-headed household living in abject poverty. The eldest daughter, Sitepi, has been caring for her 3 siblings since their mother passed on. She was later relieved after an uncle in Limpopo took in the 2 younger siblings. Left to fend for herself and her other sister, Sitepi says they're surviving on her children's grants, and the pandemic has made their lives even more harder.
We used to get food parcels from the government before, but they were stopped after my 2 siblings were taken because they are underage. So we are surviving on my children's grants ever since.
The General Household Survey data of 2019 showed that there were about 74,000 child-headed households in the country. 57% of these households included 1 or 2 children who were aged 17 or younger.
The majority of such households, close to 29%, were found in Limpopo, followed by KwaZulu-Natal, where close to 20% of child-headed households were found. Eastern Cape accounted for close to 14% of child-headed households in the country, while almost half of child-headed households were headed by 18 years old. More than a quarter of such households were headed by children aged 17 years old.
While most depend on social grants, they are not enough. Now other NGOs are lending a helping hand.
What child and youth care workers do is access food parcels, work with social workers to see if social security grants can be accessed to these families, hold family meetings including neighborhood so that we can see that the neighbors can provide a protective environment around them, and ensure that young people are supported with educational support for their own growth and progress at school.
Some single parenting households also depend on the food distribution. Their means of livelihoods have also been crippled by COVID-19.
We started the soup kitchen and blanket drive and giving people food. This is obviously by no means a sustainable thing. It's very temporary. But, the little that we can do goes a long way.
We've got a whole lot of goodwill among South Africans. And I'm saying this out of the experience of visiting some of these centers and seeing that what we are providing as the department and as a portfolio might not necessarily be adequate. But I'm also aware that there are foundations that are doing the best that they can to make sure that they support our centers. But there are foundations who also have data about the child-headed households.
For child and youth-headed homes, the risk isn't only of having to cope without parents, but that of suffering under poorer living conditions. Mulimone Moto, SABC News, Pretoria.